conventional healthcare approaches are evident. To resolve the unmet clinical needs through transformative solutions, healthcare innovation is critical.
However, turning an innovative idea into a product that actually benefits and reaches patients is never easy. That's where NHIC comes in.
As a driver of change, we are always asking ourselves, how do we bring this idea to the patient and people to make a difference that matters?
Ladies and gentlemen, of course, let me introduce what's coming up next live here at the Beyond stage. I want to let you know that we do have a full house. So to my friends standing at the back, I wanted to tell you that there are more chairs available in front. There are 3 seats available. I do see an in-between space right there at the back too. So if you'd like to join us for the next session, please, of course, fill up the seats in between. We welcome you to, of course, get cozy with us. Next up, we have the Fireside chat with, of course, Professor Kenneth Mark. We're focusing on national strategies, policy priorities, and initiative aimed at integrating precision medicine into our healthcare system. Now, this session is brought to you by DXD Hub and supported by CRIS. Join me to welcome on stage Professor Kenneth Mark, Director General of Health at the Ministry of Health Singapore, and Dr. Wang Rui Fen, CEO of DXD Hub, to moderate the session. Let's give them a very big round of applause. Welcome.
Thank you. So good morning. Actually, it's a great pleasure for me to introduce Prof. Kenneth Mark for the Fireside chat this morning. Maybe a very brief introduction of Prof. Mark for the benefits of our guests from overseas. So Professor Kenneth Mark is our Director General of Health at the Ministry of Health in Singapore. And as Singapore government's principal medical advisor, Professor Mark actually oversees the delivery of all health services in Singapore. And on top of that, he also leads the development and implementation of key national healthcare policies in areas such as population health, healthcare regulations, communicable and non-communicable diseases, healthcare professional standards, as well as the development and enhancement of performance of the nation's healthcare system and services. I promise this is a simplified version of an introduction for Prof. As you can imagine, he's an extremely busy person. So thank you so much for accepting our invitation to the chat this morning, DGH.
Yeah, thank you very much.
So, Singapore has long been recognized as a leader in healthcare innovation. In fact, the World Index for Healthcare Innovation has consistently ranked Singapore among its top 10 lists in the past actually many years. But now as we continue to see an improvement in sort of life expectancy in Singapore, I think the national conversation now has shifted from simply living longer to living healthier for longer. So then I think, Prof, to get started on the conversation today, may I invite you to perhaps share how this shift from lifespan to health span is now shaping Singapore's national health policy today?
Thank you very much for the opportunity to come and share and have a conversation with you. The question you asked actually is a very important one for us, and it's something we've been debating over the last decade, not just over the last few years. We are confronted by very important and critical issues of concern. Our population is aging, and it's aging at a very fast rate. By 2030, we expect 1 in 4 Singaporeans to be above the age of 65. And that's a big change compared to, say, 10, 15 years earlier, when the statistic would have been 1 in 10 people above the age of 65. So it's a rapidly aging demographic, coupled with the fact that our replacement ratios have dipped below 1 at 0.97. So we're not even replacing ourselves. So the population is steadily getting older. That poses challenges for us because among the more elderly part of our population, this is the segment of our population that actually uses much more healthcare services because the incidence of chronic disease is significantly higher in the older population in Singapore. And with the aging population, we're not just seeing people with one chronic medical condition, but in fact multiple chronic medical conditions all at the same time. So we're seeing an increased utilization of health services. When people get admitted in the hospital, they're staying much longer in hospital, and they're using much more of the services that we have. And this is economically not necessarily very sustainable. The cost burden of sustaining these health services has increased very steadily. Right now in the national healthcare budget, we are second only to defense, but within the next 4 to 5 years, we anticipate we might even exceed defense in spending just to support our aging population. So a change needs to be done from how we traditionally look at the delivery of health services, looking at just providing health care to treat patients with illness, to moving up the upstream in order to try and tackle this. We would still continue to optimize the capacity we have to cater for our population with ongoing and increasing health needs, but we do need to do something to significantly shift the needle. And this is the basis for which we've moved much more decisively now at a population level into looking at preventive health, preventive strategies, and what underpins the design and introduction of what we call Healthier SG in Singapore, which is our preventive population health strategy.
Thank you, DGH. So I think what you have highlighted is how a rapidly aging population, coupled with chronic disease expansion, that are now really the drivers for this gap in health spans, and which then naturally leads to Singapore's sort of increasing emphasis to look at preventive care. In that case, could you maybe perhaps share how Singapore is orientating its sort of healthcare system towards this preventive care design, maybe from a population, a community, and individual levels?
Yeah, so we're looking at a variety of different strategies tiered at multiple levels. On the one hand, of course, there's the optimizing of care we want to provide for individuals where they are, shifting care well away from care delivered by specialists in institutions to much more care that's actually delivered in the community and homes. We are looking towards encouraging as much of the population to take ownership for their own health issues, and that involves co-partnering with patients in their care journey, as opposed to being very prescriptive, having a very paternalistic view towards the delivery of health services. And this involves a mindset shift as much as it is in terms of shifting our focus on how we want to expand our capabilities and capacity. But as we move upstream, there are a variety of different approaches that we need to also start looking at. We need to better sense make what the health needs of our population are, and to be able to understand better which of our population, which segments of our population, in fact, are at higher risk of developing these chronic diseases with a much faster trajectory towards getting there, or if they start getting illness like diabetes, what sets them off to getting more complications associated with their diabetes. So that actually requires us to start thinking about how we want to identify this group of people, how we want to sense make where they are. We work with our regional health systems in population outreach to reach out to them. But at the systems level, we need to look at how we use data, and therefore increasing use of data analytics in AI to better understand where that at-risk population is and how we want to identify strategies to reach out to them. That becomes important to us. We're also looking at other interventions in the preventive space beyond screening. For Healthier SG, which entails empowering individuals to have a healthy, trusted, and long-term relationship with their GP, it allows us then, once a relationship forms, to overlay other activities on top of that, which includes crafting a health plan which patients can co-own with their GP, allowing us to then carry out various interventions. But the data becomes important, and that data allows us to aggregate and start thinking about how we want to better sense where they are, bringing actionable insights back to the GP and healthcare practitioner to better empower how they look after their patients for better outcomes. So that's another area that we actually are looking at. In the preventive predictive space, we've been looking at also how we want to better sense make patients with illnesses that if picked up early with tighter control of their conditions, it may lead to better outcomes. And an example would be familial hyperlipidemia, an example of which was actually shared at the previous panel. This year we launched the National Familial Hypercholesterolemia program, and that involves GPs using simple tests to pick up at-risk individuals, referring them into our national system, which involves doing the genetic tests and genetic counseling, finding the individuals that do have gene variants that that are markers for familial hyperlipidemia, returning these patients back to GPs with advice on how we should set more stringent targets to control their condition, and then doing cascade screening to pick up family members that also have the same gene variant. So we started with one program, but we have interest in then expanding this progressively to look at other conditions that have genetic basis as well, and therefore in a stepwise but phased manner, then set up an entire ecosystem that's now predominantly anchored around precision medicine technologies, and then to move this along. In patients that already have illnesses like cancers, we work with our national centers towards a much more personalized approach in how we want to optimize treatments for cancer. And this is something that's an ongoing conversation about how we want to start bringing gene testing with a view towards trying to identify personalized treatments that make sense to patients for better outcomes. This is something that it's not fully rolled out, but I think this is aspirationally where we think we want to go in terms of building the ecosystem that better supports personalized preventive treatments and curative treatments being provided. I'm, in the Ministry of Health, interested also in creating infrastructure that better supports the advent of these technologies. So we're looking internally within the Ministry of Health about how we want to manage data in terms of putting in place policies, some of which would be anchored by new laws that we want to put in place in Singapore that drives how we approach data disclosure, data privacy, data sharing. And that includes what we want to do is, in the context of gene testing, variants of uncertain significance, how and when those should be disclosed to patients, what should be disclosed in medical reports, how that influences insurance underwriting. And these are all critical elements in an infrastructure that then better supports the advent of new technologies being introduced in the mainstream. But without them, it's a much harder journey to start bring these technologies into mainstream practice. So at the ministry, the infrastructure is also important to us, beyond talking about the individualized journeys, the personalized treatments, screening approaches that we want to have.
Well, this is very insightful. So I think we started from preventive care as a discussion, and that really is a sort of approach looking at a very broad level population sort of health control efforts. And then you touch on precision medicine at the individual levels. So then perhaps are we then really looking at a model of care for Singapore where we are really looking at a model of maybe more precision preventive care, where prevention itself it's becoming more and more individualized?
Yeah. It's often a paradigm shift for many ministries, agencies and jurisdictions where we struggle with the issue of how we want to optimize treatments at a personal level, but also at the same time look at treatments that need to be rationalized in a setting where healthcare resources are constrained at a population level as well. So while we recognize that technologies allow us to choose the right treatments that give the best of outcomes, we do need to also think about how we want to do this with clinical effectiveness and cost effectiveness taken into consideration. And these are increasingly the conversations we have, not just within ourselves, but also with the pharmaceutical partners that we have in the industry. We have a health technology assessment agency called ACE, the Agency for Care Effectiveness. And together we've been talking about launching more health technology assessments and economic analysis to help us to better understand what the cost effectiveness is for these technologies as our clinicians work with us to define what constitutes clinical effectiveness. So we have appetite to develop these strategies further in both the population and the personal level. But I think what underpins a lot of these considerations is to better understand what makes sense for us in the system that we work in, with clinical and cost effectiveness brought in. So this brings us then to yet another strategy that we've adopted, which is what we call appropriate and value-based care, AVBC for short, where we actually define that quality, that outcomes we desire at a certain equitable price point that actually makes sense for us in the system.
So actually, so to summarize, is really that the intersection of preventive care and precision medicine is really about a balance between broad population efforts and a more targeted interventions at targeting the at-risk populations. That itself sounds a very challenging job in itself, right? And then DGH, you talked about some of the key enablers. Beyond having the right technologies for the right clinical use, there's also the infrastructure, the ethnics, and other ecosystem enablers. And you thought about cost effectiveness. And then I think that then will bring us to I think another key consideration on this, really thinking about how do we bring all the policy into clinical practice, with healthcare financing being a key considerations, right? So maybe if we can take the next 2 minutes to have a deeper dive here to really look at accessibility and access. As I believe many of us will have that questions in mind as we think about implementation of precision medicine in routine care, right? Because subsidies will naturally be a very important considerations when it comes to sustainability for the healthcare system. As our innovators in the rooms are looking at developing tools that will allow us to better do precision medicine, I think the consideration for many individuals is whether or not this kind of innovations will be too expensive for the system as a whole, and therefore eventually there might be a chance where we are actually driving the cost of care higher as we think about adoption of some of these technologies. I wonder whether at this stage, will you be able to share then at the ministry level, what will be the kind of primary considerations that the ministry would have in deciding what to support and how to support some of these new tools?
Yeah. Well, I'll have to be honest to state that this is still a work in progress for us. While I've mentioned some of our key considerations, talking about value and cost and clinical effectiveness, it's actually important for us to think still what makes sense for individuals in the best interest of a patient or person-centered care, but yet at the same time looking at it from a population perspective, because as we provide subsidies, it is also from the point of view of risk pooling and ensuring that there's a maximum benefit with the limited resources we have for the entire population. So there are certain use cases that particularly challenge us, and it's still not a minefield, but an area that we are sensitively trying to navigate through. So an example would be in the context of rare diseases. We know that in fact many of these conditions are associated with now in evolving, increasing armamentarium of treatments that may be available to us, but they come at extremely high cost. And sometimes these treatment regimes might be $1 million, several $1 million coming in, and increasingly that seems to be the trajectory. We're not necessarily against introducing such technologies in, but we do really want to scrutinize then what is the clinical and cost effectiveness, looking at it from both the population and individual lens, and try to think about perhaps even more innovative ways in terms of helping to ease the burden for individual patients and their families when it comes to looking at this. We've also been looking very critically about how we want to set thresholds and our willingness to pay threshold for in economic analysis when it comes to the management of rare diseases and these treatments, whether on the biologic or other gene therapy front. But it's an ongoing conversation. I think there will be no model answers that will be available in the short term. And as technology evolves and how we use and how our clinicians recognize standard treatments, our understanding of what we should support and ease that financial burden for our patients will also continue to evolve. It's also important for us to recognize that as we talk in terms of developing these data and clinical services, we should also have a mindset also about in the area of research, and we need to also think about the opportunities we have to use the data, the technologies we have to drive both research and create some level of synergy between the research front and the clinical front. While we can talk about it theoretically from the point of view of treating new conditions, new treatments, and so on, actually research also plays an important role in helping us to define that value. And that also helps us to better understand then what we should fund, what should we subsidize, and what we should then support as introduction into the mainstream in Singapore.
Thank you so much. I think this is very exciting journey ahead. I think as we look ahead, it's very clear that Singapore's approach to health will continue to evolve. Now we're talking from preventive care to precision preventive care, from lifespan to health span. And then I think DGH, you sort of highlighted a key critical considerations beyond technology, looking at the infrastructure, the ecosystem around technology, around healthcare, thinking about the cost effectiveness. For from a sustainable healthcare financing point of view, continue to double down on research so that our decisions, our policies are very evidence-driven.
Yes. And one also evolving thing is the evolving change in the relationship that the ministry has with its partners. In the past, just as we talk about care model, that tends to be a lot more paternalistic in how we're moving into a much more patient-empowered phase in how we deliver care with informed consent. Actually, the same thing also needs to evolve in our relationship with stakeholders in the community as we script out and define what becomes the mainstream in terms of services we provide. That involves new, renewed, and healthy conversations with strategic partners in the community, whether it's in the pharma industry, the technology space, in the research sector, and then embracing that they all will have emerging roles in helping us to co-script what that evolving healthcare system is going to be like. We have some appetite to loosen the leash, so to speak, and restrictions to exploring how best to do this. We don't know how far we'll go and how much of a free space we will create. But I think through a careful application of sandboxes, safe spaces for those conversations, it helps us to perhaps define new areas in which we can think about partnering and collaborating, particularly in the precision and personalized medicine space.
Thank you so much, DGH. I'm very mindful of time, so maybe perhaps to wrap up the conversation, would you have a message for, I think most of our audience in the rooms are innovators or clinician innovators, to really think about their role in the Singapore journey moving ahead?
Well, I guess the last statement I made just now was a bit of a encouragement to all of us as well. It's actually very exciting times that we have. New technologies coming in. The pace of change is actually quite fast. We don't pretend that all technologies will start in Singapore. That's not the case. In fact, if anything at all, sometimes we are seen as late adopters. And there's a certain amount of historic caution in how we look at this. But we depend on our community partners to sense-make and help us to better understand the direction in which technology is driving us and how healthcare innovations provide a new model of care that becomes the mainstream. And therefore, we hope to be able to work with as many stakeholders as possible to help us to co-design, help us to sustain the imagination of where we can go, and then think in terms of the conversations we want to have with them to help to co-script where we are, what eventually our health system will be like. We have an appetite to explore the new, but it has to be always based on what constitutes clinical and cost effectiveness. And therefore, I think these are the conversations we need to have from now onwards with the industry, with researchers, with patients as well, who are advocates for change.
Thank you so much, DGH. So our apologies, we don't really have time for Q&A today, but I checked with DG. He promised to spend a few minutes. If you have burning questions, please catch DGH on the way later for your questions. Can I invite the audience to maybe put our hands together to thank DGH for the insight?
Thank you very much.
And also to thank Dr. Raven for moderating the session as well. Can we please give her a round of applause? Thank you for all the questions. We will see you downstage, and I believe you have a few quick seconds to come and get
In a world
Prof.
grappling with unprecedented health crises, the shortcomings of conventional healthcare approaches are evident. To resolve